Mr. President, I also want to address a critical issue today to Westerville, Ohio, and frankly, every community that I represent in my state and communities all over the country. Today, I want to talk about the opioid epidemic that is gripping our country. Every state represented in this chamber has had too many communities devastated, families broken apart, lives taken by the opioid overdoses. The Centers for Disease Control now tells us that more than 63,000 Americans died from drug overdoses for the last year for which they have records, which was 2016. It also looks like it was worse in 2017. More Americans are dying from drug overdoses than the total number of casualties during the Vietnam War. Every year, more Americans are dying from drug overdoses than the total number of casualties from the Vietnam War. Think about that. It's a staggering statistic. On average, more than 174 Americans died every single day from a drug overdose in 2016. That's up from 143 Americans in 2015, 105 Americans in 2010. In other words, it's getting worse. 2016 was the deadliest year on record, and initial estimates for 2017 suggest it's going to be even deadlier, including in my home state of Ohio. Opioids, prescription drugs, heroin, synthetic forms of heroin are increasingly the reason why. Opioids were involved in about 2/3 of all overdose deaths in 2016, and opioid overdose deaths were 5 times higher in 2016 than they were just back in 1999. So in the past 17 years, we've seen a 5-fold increase in these overdose deaths. It's a national epidemic. It's unfolded in 3 different ways. It started with prescription drugs. So overprescribing of prescription drugs, pain pills, the pill mills that we saw in southern Ohio and around our state. This exploded about 15 to 20 years ago. Next, the heroin deaths. Heroin moved in and spiked as people moved to less expensive and more accessible alternatives than prescription drugs. And now, I hate to tell you, there's a new danger and a threat, and it's deadlier than ever. And it's these synthetic opioids, fentanyl, carfentanil, that have moved into our states, overcoming our law enforcement, and the results have been deadly. By the way, it's a crisis that does not discriminate. Opioid addiction affects everybody, regardless of age, area code, class, color. In Ohio, drug addiction and acts committed to support it have now become the #1 cause of crime in our communities. Probably the same in your community. Employers, of course, are increasingly pointing to the inability to find workers who can pass a drug test. They can't fill vacant positions. There's new data out with regard to people who are not showing up in the unemployment rolls but have given up work altogether, looking for work. There are probably 9 million men between 25 and 55 who are considered to be able-bodied who aren't even looking for work. Some really troubling statistics out there indicating that maybe as many as half, one study says 48% of those individuals are taking opioids on a daily basis. This is affecting all of us. Every aspect of our communities are affected. Everyone has a role to play in overcoming this epidemic. There's an urgency with coming up with better strategies to turn the tide on addiction. And although I believe progress has been made recently, and is starting to be made in my state and other states, much more needs to be done, and done urgently. Part of that starts with understanding that addiction is a disease, and that it is treatable. Too often it's not treated like that. The appropriate response should include much more aggressive prevention and education, absolutely. More aggressive law enforcement, keeping fentanyl, deadly fentanyl, out of our communities through the STOP Act and other means, of course. But we've also got to get more effective treatment strategies. We have a couple 100,000 people in Ohio who are addicted. We need to get them into treatment, including more effective detox, medication-assisted treatment, and longer-term recovery. We know that coupled with the right kind of therapy, the right kind of support and help, that people can get into recovery, get back to their families, get back to work, and get back to being productive citizens. We also know that recovery results are a lot better with that kind of continuous support. Closing the gaps that occur is key to overcoming addiction. There's a gap between the crisis response which is often a first responder, like the two brave officers I talked about earlier, finding someone who has overdosed. Often it's firefighters as well, providing Narcan, this miracle drug that reverses the effects of the overdose. That's incredibly important to save lives. But Narcan alone is not sufficient. The key is then to get those people into detox, into treatment, into longer-term recovery. The gaps we have out there between that crisis response and Narcan and then going to detox and then going to treatment and then going to recovery, that gap is creating a lot of the problem, the inability to solve this problem. I can't tell you how many people I've met, and I've probably met a couple thousand addicts or recovering addicts in the last few years, and what they tell me is, yeah, I tried treatment, but it was for 6, 7, 8 weeks, and then there was nothing for me. It didn't work for me. Or people who overdosed, not once, twice, but several times, and they were never then in detox and treatment. And one young man I spoke to last weekend has been an addict for 7 years. Finally, his brother convinced him to seek help. And the last time he overdosed, he did go into detox, he did go into treatment, and through a facility where those gaps were closed, where there was no waiting time, where he was able to get the help rather than going back to his old community and his old friends, and a situation that was going to lead him back into more use and more addiction. The key, again, is to get those who have overdosed into the treatment they need. Overdose reversal provides a second chance at life. Let's face it, some of these people who are overdosing come out of this after Narcan is administered, and they've seen their life flash before their eyes, and they're ready. They're ready for something. We've got to be ready for them. But just as that overdose reversal provides a second chance at life, it is treatment and longer-term recovery that provides that second chance to live addiction-free. Again, to get back with your family, get back to work, get back to a productive life. It takes a comprehensive solution because it's a comprehensive problem. That's what led some of us here in this body, including my colleague, Senator Sheldon Whitehouse, and me, to introduce the Comprehensive Addiction and Recovery Act, or CARA, back in 2015. We developed that bill over time by relying on experts in the field and those most affected by addiction. Beginning in 2014, when we were in the process of putting together the legislation, we hosted 5 national forums here in Washington, D.C. We brought experts and practitioners in from around the country. Prevention, treatment, law enforcement, recovery community. We wanted to get best practices, to find out what was working, what wasn't working, how we could improve the response, what role the federal government could play in all this. We had forums focused on the science of addiction to understand that better, evidence-based prevention strategies that actually work, treating pregnant women who are addicted and babies who are at risk of being born drug dependent. There is nothing more heartbreaking than to go into the neonatal units in the hospitals in my home state and see these babies who were born dependent and watch them going through the painful withdrawal process as infants. Every neonatal unit in our country has seen this, and if you go to your own hospital, they will tell you this is an increasing problem. We had veterans come in and experts on how to help veterans make that transition, because sadly, the use of opioids among veterans is also increasing. Sometimes using opioids for injury or accidents or PTSD, they become addicted. How do you build support around those veterans? We also had people come in and talk about longer-term recovery and sober housing and how you can, over time, get better results if you provide those kinds of services. Our goal was to leverage the expertise and perspectives of everyone involved in this epidemic, to find best practices, and to create an evidence-based education, treatment, and recovery bill that works. With strong bipartisan support, we moved from hearings to a unanimous committee markup to Senate passage of this legislation. By the way, it passed with a vote of 92-2. Now, that's not typical around here, certainly not for something so comprehensive, and yet everybody is experiencing this back home and desperate to figure out strategies to help. In July of 2016, President Obama signed CARA into law. It was the first comprehensive addiction reform in more than 20 years, and the first time Congress had ever provided any support or help for this longer-term recovery piece. It targets prevention and education resources to prevent abuse before it even starts, the most effective way. It helps first responders reverse overdoses to save lives. It devotes resources to evidence-based treatment and recovery programs. It expands prescription drug take-back programs to get addictive pain pills off the bathroom shelves. It authorized more than $180 million to assist communities in these efforts to combat this epidemic. And frankly, because of this crisis, the appropriation bill that then spent that money decided, you know, we need this so badly, we're actually going to appropriate more than the $180 million. They appropriated $267 million this last year, as an example, almost $100 million beyond our authorization. And again, I think it's beginning to make a difference. I see it back home in Ohio. I see some of these strategies beginning to work. It's going to take some time, and we need to do more. In Ohio, we've received about $4 million, and I say we, it's groups, it's people who are in the trenches doing the hard work. We've also made progress in this fight with separate opioid legislation that was part of the 21st century cures legislation. This is for substance abuse and mental health. Many of us fought successfully to help secure a 2-year commitment there of $500 million a year, $1 billion, that goes directly to the states. So this money goes to states that are hardest hit, allowing the states to decide how to spend that money. The first installment of that legislation awarded my state of Ohio with $26 million, and we're using every penny of it. I was at a facility over the weekend that gave me hope. It's called the Mary Haven Addiction Stabilization Center in Columbus, Ohio. I talked earlier about the gaps where people overdose, they're provided Narcan, and then they go back to the community, and what first responders will tell you is sometimes in the same week, even in the same day, in some occasions there's another overdose, and the revolving door continues without any treatment, without any solution. Mary Haven Stabilization Center is a response to that. They use the cures money we talked about. They use some CARA funding from the county. The county is part of a broader strategy where the CARA money went. And they said, let's put together an institution where we have an emergency room that focuses on overdoses. In Columbus, Ohio, I've been to other emergency rooms and seen what they do with the overdoses. They save lives, and that's fantastic. But frankly, these emergency rooms are equipped for everything. They have to be for gunshot wounds, or for car accidents, for trauma. This emergency room will be focused specifically on overdoses, which makes it much more cost-effective, but also more effective for those recovering addicts, those addicts who are coming in. But most importantly then, in that same facility, there's a detox center. In that same facility, there are 50 beds for treatment. And whereas the typical case is somebody overdoses, goes to the emergency room, and ends up going back to the community, back to home, back to the gang, back to the family, in this case, 103 people have gone through in the last month. It's only been open a month. 80% of them have gone into treatment. And I got the opportunity to meet someone who had been through that process and talked about the difference this makes. You literally walk through the door into treatment, and there's a strong encouragement to do it, and it's working. So these are the kinds of things that are going to make a difference in our communities. It seems common sense, but frankly, it's not happening in other places. Programs like this is what is going to help us overcome addiction, and are examples of how federal funds can be used more effectively to leverage, in this case, a lot of private dollars, some state dollars. Both of these landmark laws, the CARA Act we talked about and the Cures Act, are providing increased resources to local communities. But again, this problem is not getting better. It's getting worse. One of the problems is the availability and the low cost of these highly addictive, even more dangerous drugs coming in that are synthetic opioids. Fentanyl is 50 times stronger than heroin on average. It's coming in through the mail. Again, we need to do more to stop it through law enforcement, but also we need to acknowledge it's being sprinkled in other drugs and creating a lot of these addictions, overdoses, and higher rates of death. The degree of damage it's causing our communities, our families, our budgets locally, our criminal justice system requires us to take a more aggressive stance, to do more, to figure this out. We need to strengthen our resolve. And again, we made progress recently with the bipartisan budget agreement that President Trump just signed into law a few weeks ago. There, we included an additional amount of funding, $6 billion over 2 years, to help combat the opioid epidemic. So instead of the $500 million a year and the $260 million a year I talked about, it would be $3 billion a year, and then $3 billion the year after. I believe that the evidence-based programs we set out in the Comprehensive Addiction Recovery Act provide a good framework as to how to spend that money effectively. That's why I'm pleased to stand here today as we introduce the next stage of this, CARA 2.0, to help provide a framework for how these funds to combat opioid addiction can be spent wisely. It's a roadmap for Congress to build on CARA's successes since becoming law. The Bipartisan CARA 2.0 Act is being introduced by Sheldon Whitehouse and myself again, but also by 6 other colleagues, Senators Shelley Moore Capito, Amy Klobuchar, Dan Sullivan, Maggie Hassan, Bill Cassidy, and Maria Cantwell. A bipartisan group of 4 Republicans and 4 Democrats who are passionate about this issue. It authorizes $1 billion a year for specific evidence-based drug prevention, education, treatment, and recovery programs. Look, it's very important to have this $6 billion in funding over the next couple of years. We need it. But we got to be sure it's spent wisely. It's not just a matter of throwing money after a problem. It's a matter of being sure that we are effectively addressing the real issues. As I mentioned earlier, the longer-term recovery programs are what really helped those gripped by the addiction overcome this disease. That's evidence that we have. I've certainly seen a lot of evidence of that firsthand, and countless examples of this where this longer-term recovery and the support networks is what gets people back on track, back with their families, back to work. We need to expand access to them, to those communities that are in need, and to give everyone a second chance of living up to their own God-given potential. That's why in this new CARA 2.0, we do increase the funding for recovery. In addition to expanding the reach of CARA's evidence-based programs, this bill puts in place new policy reforms to strengthen the government's response in so many ways. We take what some will consider a pretty dramatic step, and that's to limit opioid prescriptions to 3 days for acute pain. Some will push back against that, but this is based, again, on good evidence and good research. When someone goes in for a simple procedure, say a wisdom tooth extraction, and that young person is given a bottle of opioids when he or she leaves, too often that leads to addiction. And I don't want more parents coming up to me and saying, my kid, when he or she was a teenager, was given these opioids by a doctor, a dentist, so we thought it was safe. Our child then turned to heroin because the pills became too expensive and less accessible, and then to fentanyl and overdosed and died. I've had 2 such parents come to me and tell me their story from Ohio. You probably know others. We need to ensure that these prescriptions are limited. For those who have chronic pain, those who have cancer, wouldn't apply. And after those 3 days, you can go back to that doctor and say why you need it and explain it. Experts say about 80% of those who overdose from heroin started on prescription drugs. I'm sure the same is true with regard to fentanyl. So 4 out of 5 heroin addicts who overdose in my state of Ohio started on prescription drugs. We do need to deal with this overprescription problem. By the way, the evidence is that after that 4th day, 5th day, 6th day, that's when you get into the bigger risk of becoming addicted to prescription drugs. As I mentioned, this epidemic started with an explosion of pain pill use 15 to 20 years ago. We need to stop the addiction at the source, and for most people, that begins with prescription drugs. By ensuring clinicians prescribe the appropriate strength and supply of pain pills for non-life-threatening injuries, we can help so many more people from becoming addicted. The bill also includes legislation very similar to that which passed the Senate in 2015 but was dropped out in the House-Senate conference. It's very simple. It requires doctors and pharmacists to use the drug prescription monitoring programs to ensure we're not overprescribing opioids for certain individuals. That helps us identify where the problems are, get people into treatment. It also requires states to share data with other states to prevent people from crossing state lines to get their prescriptions. One of our big problems in Ohio is people can cross the state lines into West Virginia or Kentucky or other states and get their prescription filled even though it's already been filled once in Ohio. We need to have across state lines prescription drug monitoring programs that work. CARA 2.0 is going to help turn the tide of this epidemic. The bill increases federal funds for specific evidence-based programs to better protect vulnerable groups, including infants, young adults, pregnant and postpartum women, veterans, as well as resources for community programs, medication-assisted treatment, and first responders. As the title indicates, it's a comprehensive solution. Every aspect of our communities are affected, so every aspect of our communities need assistance. The opioid epidemic is one of the most urgent challenges we face as a country. Ultimately, this crisis, by the way, is not going to be solved here in Washington, D.C. It's not going to be solved by legislation we pass here. We get that. It's going to be solved in our communities. It's going to be solved in our families. It's going to be solved in our hearts. But this is a national crisis, and the national government needs to be a much better partner with state government, local government, communities, nonprofits, those who are out there doing the hard work. This $6 billion commitment that's now been made over the next 2 years is a real opportunity to help turn the tide. Again, not by just throwing more money at the problem, but by being sure that money is well spent on an epidemic that's taking too many lives and devastating too many communities. CARA 2.0 will build on our accomplishments and continue to give communities the resources they need to address this issue. Yes, we've made some progress around here, and that's good, but we need to do much more. CARA 2.0 gives us that opportunity. It represents the next step towards helping our communities address this epidemic and helping our communities heal. Thank you, Mr. President. I yield back.